These are the most advanced treatments for your thoracic outlet syndrome that you can do by yourself. And I'll be covering everything from the most basic exercises to the most advanced massage techniques. Starting with the most basic but important exercise for thoracic outlet syndrome, and that is going to be the front pulls. And the reason why this exercise is so important is because by strengthening the muscles in the upper back, like the rhomboids and the mid traps, you're going to help prevent the muscles in the front of the body from compressing on the nerves and blood vessels, which is the literal definition of TOS. Now, in order to perform front pulls, all you're going to do is take your band, hold it up in front of you, and then pull it apart, hold for a second or two, and then let it return. Pretty simple. And regardless if you're doing a front pull or let's just say a reverse fly, because it's pretty much the same movement, they're all doing the same motion. They're all performing scapular retraction. And if you want to do any of these exercises right, it's not necessarily going to be the form, even though it is important. What it's going to be is the initiation of the movement coming from the actual rhomboids, coming from the muscles that do that action, scapular retraction. You see, the biggest issue with a lot of these front pulls is that most people just kind of pull it apart using their arms, using the triceps, using the shoulders, but they neglect the upper back muscles. But if you start the pull with the upper back pinching, which then pulls the arm out, almost like a leverage here, almost like a pulley system, I guess more of a leverage, then what ends up happening is those muscles will initiate the contraction. They are contracted the entire time if you're holding it, and to keep it there, they're going to be the last ones to let go of that contraction. Now, one of the next techniques you can do for treating your TOS is going to be a stretch. And if you can only pick one muscle to stretch, that should be the chest. And the reason why is because the chest region, the thoracic region, is going to be full of areas that can create some kind of TOS pain. Whether it's the pec minor compressing on the nerves and blood vessels directly behind it, or it's the pec major that's full of trigger points, making it feel like you have TOS-like pain. Regardless, stretching out the pec major region is going to help you with your posture and your pain and hopefully improve your TOS symptoms. Now, before doing anything else, place your hands up and then pull your elbows straight back just to do a very simple basic test here to see which side feels tighter and to see how far you can go back. You can simply look into a mirror at the side to see how far it goes. Just don't try to force yourself. Go until you begin to feel that stretch and then stop. If you have one side that is tighter than the other, then try working on one side first or stretching it and see if you can feel a difference between the two. Now, in order to get started, all you need to do is find something like a simple wall. You can find the corner, or you can even use the side of your chair, the back rest, in order to anchor your arm and your elbow. What you want to do is basically get your arm up at roughly 90 degrees to get into your starting position. Now, from here, we have two different moves to put the pec region on a stretch. We're first going to step forward, which is going to create some kind of shoulder extension towards the back. And then we're going to rotate away from that shoulder in order to create external rotation. So from here, this is your basic chest stretch. Now, the chest stretch is great and all, but I'm sure you've done this before. So let's make this a little better. Let's make this a little more personalized here. What we want to do is get back into that basic stretch position. But from here, we're now going to take that elbow and we're going to slowly move it up and down the body. And the reason I say the elbow is because that is the joint next to the shoulder where the muscle is located. And it's easier to kind of think about the shoulder or the elbow moving up, than the hand reaching up. This way as well, your elbow is staying up against the wall, which makes it easier to keep the muscle on a stretch. So what you're going to do is simply go up as high as you can while holding that stretch. And then you're going to go as low as you can. Once again, just trying to get to that end range of motion while holding that stretch. And what you're going to be doing here is simply trying to find which angle is going to be the tightest, which one feels the most restrictive here. And that is going to be the angle that you are going to stretch out for that chest. But we are not done yet here with this stretch, because we can step it up another notch by performing what's called a PNF stretch. That stands for proprioceptive neuromuscular facilitation. It's pretty much a fancy way of tricking the nervous system into allowing your muscles to stretch an extra inch or two immediately after doing this little technique. Here's how it goes. Get back into that stretch position. I'm just going to stick it to the 90 degrees for basic demonstrations, but you would want to get into that angle that feels the most restrictive for you. But from here, all you're going to do is now contract the muscle that we are stretching. In this case, the pec major, the pec minor. So to contract the pec major minor, think about doing a chest fly, but you're only doing it with the arm that is stretched. And of course, because the wall is in the way, you're not going to be able to move. So I'm contracting the muscle with about 10 to 20% of my strength, and I am doing it for about 10 to 15 seconds here. Now, once time has elapsed, what you're going to do now is do the opposite contraction you're doing. Since I'm doing this way, I'm now going to want to pull it outward, do a reverse fly. And as I do a reverse fly, I'm going to lean into the wall just a little more. And now I have a better range of motion. I can now hold this stretch for another 30 to 60 seconds, and then repeat this process another 2 to 3 times. Now, before we get into the best kind of treatment for thoracic outlet syndrome, make sure to hit that like and subscribe button for the best content related to your TOS. The final treatment you can do yourself is going to be self-massage. And the reason why you want to do this is because those muscles that are compressed and shorn and tight are most likely full of things like fascia restrictions and trigger points, which means in order to release them, in order to release that compression and to get rid of that pain immediately, you have to release the muscles around the nerves and blood vessels. And the best way to do that is going to be self-massage techniques. And to get started, we're going to be working on the one area in the body that most likely needs it, especially if you're someone like a musician, or you're working on the computer, or just staring at your phone all day. And those muscles are going to be your scalines. They are the lateral neck muscles on your side. You got 3 of them, and it is where all of your nerves and blood vessels, it is where all your nerves and blood vessels exit out of your spine and go into your shoulder, into your chest, and down into your fingers. So to get started, we're going to be performing what's called a stripping technique. And the reason why we're using this one specifically is because not only is it going to help the muscle lengthen, but it's also going to help loosen the fascia underneath, which is a 2-for-1 deal here. Plus, we didn't stretch the scalines yet, so stretching them out while massaging them is also going to be good for you if you have TOS. Now to get started, start off on the top of the neck, apply a little bit of pressure, and then slowly drag it down towards the inside or behind the clavicle. What you're aiming for here is basically the giant SCM muscle. You're aiming for the ones behind it, so you can easily just turn your head to locate the SCM. Once you find it, you just go right behind it, and here you have a triangle of muscles, also known as your scalines. So here, I just want to apply a little bit of pressure to the top of the scalines. I want to tilt my head in that direction, and then I'm just going to slowly drag it down while also applying some pressure. Once I get to the bottom, I'm going to stop, reset, and then repeat pulling it down. Now, this is just a basic version of the stripping techniques. If you want to make them even more effective, you can also do a stretch with it while stripping it. Going back to that same position, I'm going to go to the top here with my head tilted. And now, as I drag down, going towards the body, I'm also going to tilt my head away from the massage area in order to stretch out the muscle at the same time. So you're stripping one way, you're stretching the other way, which is going to help loosen and stretch out the fascia and the muscle. Now let's take this up another notch and do a little bit of cupping. Cupping is a great massage technique for working on the deeper tissues and for helping adhesions get separated from the muscle, which will allow the tissues to slide on top of each other and even increase and improve blood circulation. So with that said, the idea here is we're going to try to help lift the tissues off, or at least create some kind of separation within the scalene muscles, which will hopefully help them decompress on the nerves and blood vessels. Now, cupping has been known to be able to get up to 4 inches deep within the muscle and affect the tissues in there. But that is not the goal today. When it comes to the scalines, the neck muscles, or basically any other area where there is a dense population of nerves and blood vessels. And yes, I said population, but we'll move on. The goal of doing this is trying to perform at least a light pressure and with very specific instructions when it comes to the neck region, when it comes to the scalines. The first rule is that we will always work from north to south, from head to the body, because we're trying to have the blood flow go down towards the body to get recirculated, re-cleaned up, instead of having to get pushed up into the head, which may create headaches and other problems that we don't want to deal with. Now, when it comes to the techniques for the cupping, we're only going to be using one type of technique, and that is called a lift and release, which I'll show you how to do in a little bit. But with that said, there's absolutely no sliding allowed and no static suction allowed on the scalene muscles. And third, again, we're trying to go at a light pressure. When I think about this, all I'm going to do is simply pull up just a little bit to create a little bit of a suction in the tissues here. And this might even still be a little bit too much. I just had to get it up and off the tissues. So just be warned, this should be safe in general for most people. If you're not sure about it, then just simply ask your doctor or just simply skip it. You know, you don't need to do this as well. Now, in order to perform the lift and release technique, what you're going to want to do here is simply just try to get a little bit of the tissue inside of the cup. Once you get it there, we're just going to pull it gently to the point where it's about to let go of that suction. And I'm going to hold it there for about 1 to 10 seconds. 1 to 10 seconds. Once that happens, I'm just going to let go, reset, and I can either work on the same spot a few times, or I can just move on to the next spot. So once again, I'm just going to pull in a little bit of that skin, pull back a bit until it's about to let go of the pressure, hold that for 1 to 10 seconds, and then I can break the seal. So let's do this on the neck. So here you can see I'm going to start at the top. I'm going to pull in just a little bit, enough to get a little bit of a suction. And then I'm going to pull back just enough right before it's about to break the seal. Hold for about 1 to 10 seconds, whatever you're capable of doing or whatever you're comfortable with. And then reset and repeat. Again, it's not a hard pull here. It is simply a lift and release. We're just trying to lift the tissues up, hold it for a few seconds, and then let it go. One more time. Some suction, pull away. Nope. Doesn't want to grab. Let me relax my neck a little bit. There we go. Oh. And now pull away just a little bit before it breaks. Definitely practice this a few times on your arm or your body or somewhere else that's not somewhere so sensitive before attempting it on your neck. As you can see by just watching the demo, it is a little difficult to do it, especially when you're kind of standing up and working on it at the same time. So having a partner do it can also help with this kind of treatment. Now, just like last week's video, inside of this video, you will find a series of hidden numbers and letters that if you put it inside the promo code for the 28-day TOS challenge, will give you a giant discount. Just make sure to hurry up and do that because those discounts are extremely limited. Or if you just want to learn brand new massage techniques in general for the rest of the body and the rest of the muscles that can create TOS pain, then make sure to watch the video in the top corner. I'll see you over there.